Welcome back again. Today I'm going to talk about project management as the future of pharmacy practice. And I'm going to discuss it based on the fact that what are the transitions that we've had in the pharmacy practice, what I've observed as a person, and what I envision for that future, looking at what are the current trends in the industry. And as we look at it, what we have to acknowledge is the fact that pharmacy practice by itself as a concept and as a principle practice in the healthcare space has been changing all over time. And with these changes, there's going to be a need to actually reinvent the wheel and look at how do we deliver better care. And one of the things that we have to acknowledge is the fact that pharmacists are considered as medicines experts. And as medicines experts, we need to look at it beyond the medicines themselves. The reason as to why I say that is because medicines is what our specialty is. We read about medicines from drug design, development, use in patients, the side effects, adverse reactions, and anything that relates with medicines. But at the end of the day, at the core of medicine use and medicine development, the main principle is to ensure we are able to design solutions that give people healthy outcomes, positive health outcomes, that is, and at the same time to ensure people are able to stay healthy. So it's not about being the medicines expert. It's about ensuring people achieve healthy lives and able to lead healthy lives. That is the ultimate results. And for us to be able to do that, then we need some additional skills as pharmacists, and we need to rethink our practice rather than the convention that has been the norm. And one of the things that I've acknowledged is the fact that pharmacy practice for the longest time possible, the core principal areas of practice for most of us, especially in the Kenyan context, has been either we're in the community pharmacy or we're in the hospital setup. In the hospital setup, we do our work based on what has been the standard. We are following the medicine, addressing patient needs with those medicines. And even when we go to the wards, we offer care in terms of the advanced areas in practice. Let's say, for example, clinical pharmacy, medication therapy monitoring, medicines reconciliation, which are these good advances. But are we specific on how we want to do it? Are we very intentional and deliberate in terms of the outcomes that we envision achieving? And that is why I believe the future of pharmacy practice is going to be project management based. And the being project based is the fact that when we look at projects, these are short-term, actually not short-term as such, but we could say they are time-bound interventions and solutions that we design with an ultimate end of achieving particular objectives and particular outcomes. On this account, then, as pharmacists, we need to ask ourselves in the respective areas of practice where we are, what are the expected outcomes? What do we envision achieving in these areas? And for whatever it is that we envision achieving in this area of practice, then we need to look at it from a project-based kind of solution, in the sense that before we intervene in putting in place a project in scope, we need to assess the need. In the last video that I was talking about primary healthcare practice, some of the key aspects that I mentioned was in terms of what are the interventions we were able to put in place at the community level. You can give an example of the NCD's clinic. This could be like a project because we identified the need in the sense that we have patients who need medications. These are diabetic patients, hypertensive patients. And once we've acknowledged that these patients need medicines, and there is a problem because the supply chain model that has been in place for the longest time possible is not able to meet that need. And therefore, the alternatives and the actually operating metrics in that kind of an environment is the fact that patients have been buying medicine from pharmacies, from the community and all, but it's not a guarantee because we cannot monitor whether the patients are buying the required doses or not, they're complying with the doses or not. And therefore, that is where we come up with a project to look at how do we then ensure there's reliable access to medicines for our patients? And other than the reliable access to medicines, what are the different stakeholders that can help us achieve these? And in that kind of a matrix, then we start from the needs assessment, as I've mentioned. Then we go to the initiation where we've designed the concept, we give a justification as to why we feel it's the robust and the best solution that can give us the best returns. And then when we move from the initiation point, we go to the planning. From planning, we go to the implementation of the solution. Monitoring, control, and evaluation are actually part of the entire project management landscape. Then at the end of the day, at the closeout of the transition, or in the closeout or transition of the project to be owned by the community, we need to assess whether we've achieved the outcomes, which is the objective that we set out to achieve. That, for example, in this case, patients have access to the medicines they need to manage their conditions, which is one. Two, other than the particular outcome of being able to access their medicines, what would be the outputs of that particular intervention, the impact of that reliable access? The impact of reliable access is that their sugar levels are controlled for diabetic patients. Their blood pressures are controlled for the hypertensive patient. Therefore, it means that intervention is achieving the ultimate success that we envision from a core of practice, in the sense that we are looking at people leading healthy lives. If they're not healthy lives, they're able to make the best outcomes of their health condition, and we are supporting them in that journey. So that is the overview of what we look at in terms of project management. And the reason as to why I feel this is going to be the future of practice is that, one, wherever we are, there are very many different challenges that patients are going through. And if not even the patient, is the healthcare systems. We can talk about pharmacoeconomic evaluation of interventions. What are the cost factors? And generally, as a society, one of the key things that we have to acknowledge is resources are always limited, and the problems are almost always existing. And therefore, on that account, we can look at the constraints triangle, where we can talk of the three factors that would affect whether we are going to achieve our outcomes or not. The scope of the projects. I can talk of example, just the one that I mentioned on NCDs, hypertensive and diabetes patients. The scope of the problem is so huge. We can look at it from the medicine, healthy living, across the continuum of care, health promotion, disease prevention, the curative aspect, rehabilitative, palliative. So across the continuum, we have so much that can be done. But based on the particular domain and particular position that we occupy in the healthcare delivery spectrum, we need to identify what is it that we are best suited, best positioned to deliver on. And that is the first thing that we have to acknowledge. And in this case, it's about the delivery of the medicine and ensuring the patients can derive the ultimate best outcomes out of that solution. So we have identified the area, we've seen what position that we occupy, looking at the scope, which is actually broader scope, and we now limit it because we are not able to solve everything. Then we now look at the time. Over what time frame are we going to deliver this intervention? The common order of practice has been, as a pharmacy, you'd be employed, for example, let's say be employed by the government in a hospital facility, you'd be climbing up the ranks over time based on your qualification, your duration of practice and all. But what measures do we have in the impact of your delivery of care? How many patients have you impacted? Maybe we're not measuring such kind of features. And the quality of that measurement is also a critical bit in terms of how many patients have you enabled to get better outcomes? How many of them are not able to recover? And what are the supportive measures that you're putting in place to ensure they can lead better life for those who are not able to fully recover? For example, people with chronic diseases. So when we look at those dimensions and metrics of care, there's so much that we can do, but you're not going to be able to do everything. And as we can acknowledge, the routine employment that we used to automatic posting is over. And as much as it's over, now we are going to the contract base. And there's a recent article that I read from the McKinsey, where even corporations and private entities are looking at project-based management and delivery of their solutions. Companies will not run like wholesome entities that are going towards achieving the ultimate success of the company. That would be the success, yes. But in each and every company, there are different specific units, and each specific unit has a deliverable. And that deliverable will be run as a project with a project team in place, a project leader, and an execution matrix that is going to help us achieve the ultimate successes. So then we have to look at this from a pharmacist perspective in terms of our qualifications, the challenges within the healthcare system, and what we can do in that perspective. It's not going to be universal. There are some of us in regulatory affairs, like where I am now, and there are people who are working in the public health domain, the clinical pharmacy practice and all. So all these different dimensions and areas of practice abroad, you're going to need to define which particular area do you think you're good at? What can you deliver in that space? How can you design a project that is sustainable, that is effective and efficient in terms of resource use? And we know resources are limited. So which area is it? And so far over the last couple of years from 2017, I've witnessed actually growth in terms of projects that our young people are putting in place, especially in the pharmacy space where I work, and acknowledge this from even the university students. We have projects running antimicrobial resistance stewardship, resistant related projects, that is antimicrobial stewardship. We have students that are running projects related to sexual reproductive health, reactor related products. So if we look at all these initiatives, they are projects. These are young people who have identified problems in their communities. They've looked at, that is the needs assessment. They've found that they have a capability in them. They have an inclination to solving that particular problem. And therefore, they look at initiating that project, putting up the different metrics and different resources that are needed to make it work. Then from that case, some of them are going full length into implementing these projects. with monitoring key performance indicators, that is the monitoring and controls that are in place. And ultimately, at the end of the day, they are going to achieve the success that they all envision for that particular project. If they're not able to, then we've already generated that data at that particular point to acknowledge that we were not able to achieve the results we envisioned. And therefore, these are the contributing factors. What can the next generation of pharmacists do to ensure we address these challenges? And it's going to be project-based rather than practice in a wholesome ecosystem where the measurement of your contribution, your output might not be determined. So for you to be equipped, to be ready to meet the demands of the market, you need project management skills. You need to identify that particular area that you feel you're suited to address that need in that area. And once you're suited to address that need in that area, you need to read about it and acknowledge these are the challenges, these are my internal capabilities, these are the respective stakeholders and entities that are involved and interested in this particular venture, and these are the measures on how we can work together to achieve that ultimate success. As I mentioned, routine employment as we know it is not there. And therefore, the value that we're going to put into the healthcare system will be dependent with the impact of work delivery, impact of the solution we bring. Design a project, get in, plug into a system where you can deliver that solution, and it's going to be the success. I remember yesterday, on behalf of the Young Pharmacists Group, I had a discussion with the CEO of PSK, and we are looking at what are the areas that we feel there's a need. Over COVID-19, people have been talking of vaccination, pharmacists' role in vaccine administration and related. Already people are being trained, and even pharmacists are being trained to be immunizers in their different areas of practice, which is good. But what would be the measures of these? We need to identify what are the measures of success for us in terms of vaccination. And the success is not about the number of people we vaccinated. It will be, yes, measured in terms of the number of people we vaccinated, but in comparison to the cost of vaccinating through the alternative channels. Government public health delivery systems have the vaccination systems. So what were the cost implications? Can we do assessment of such? Then when we look at the other vaccinations, we could be talking about COVID-19 at this particular moment. Other than the childhood immunization programs, what are the shortfalls that we've acknowledged in these areas? What projects can we deliver as pharmacists? What can we address these challenges with? Access to medicines is a problem to some, not a problem to every other person. What solutions can we design in these areas? So once we identify the needs, specific needs that we can address, we look at our capabilities, design the solutions, and work with people within the healthcare ecosystem, we are going to be able to address these challenges. And I can give an example that is going to be the last one that I'm giving in this video as I close out. One of the key areas that I've been interested in, and this has been in sexual reproductive health. Everybody has been talking about sexual reproductive health, access to reproductive health, sexual health, and rights, safeguarding rights of the individuals around sexuality and reproductive health. It's good, yes, but what is the scope of that? The scope of it would come from the reproductive component, the sexuality component of it. Menstrual hygiene, for example, for the ladies. Do we look at it from access to contraceptives for fertility in terms of reproduction? Do we look at it from access to menstrual hygiene products, the sanitary towels, tampons, and related? Are we looking at it in terms of fertility challenges that people are having? And how are we addressing them? What is the capability of pharmacists? One of the things that I wanted to mention at this point is one intervention that the government recently started was ensuring ladies in the different schools can access menstrual hygiene products, which is a good intervention because there is need for them. And because of poverty, some ladies are not able to access them. And therefore, even their education and schooling is becoming a problem. But on the same note, we have to acknowledge that almost every community has access to a community pharmacy next to them. Imagine us pharmacists, if we could design a project looking at the need for reproductive health, for the menstrual hygiene products, that is sanitary towels, our proximity to the communities and the trust that we have with them to be the key area where they can access these resources. Designing that solution and fostering the aspect on public-private partnership, we collaborate with the government so that community pharmacies which are closer to individuals could be able to deliver these sanitary towels to the communities that need them. That would be a success because we are able to reach the communities where they are. We are not going to be affected by school closures, especially over COVID, for example. We noticed almost a year was lost. And over that year, it doesn't mean that these ladies did not need menstrual hygiene products. Their menses kept coming on a monthly basis. So what happened over that period, especially for those who don't access them? But if we use the alternative channel of community pharmacies, as I'm suggesting in this video, it would have been achievable. So we need to think of what are the challenges in our society? What preferential advantage and vantage position do we hold in the continuum of care? And how can we position that solution to collaborate with stakeholders within the ecosystem and the framework to deliver that solution? And if we're able to do that, we are going to make our value be felt in the ecosystem. We are going to re-envision and reimagine the wheel of our care that we deliver in terms of what does the role of the pharmacy entail. It's not only going to be the clinical area that we've been used to, the narrative that we've been selling, but we'll be giving the evidence and the data, and we'll get the support of the communities that we're serving, because that service is to them. And that is what we commit to when we take our oath at the end of our training. So why not do it to the end of the day? I believe we're able to do that. And for all of us, I encourage us, let's do project management, get the skills, get the training, plug into other projects in your ecosystem where you operate, because by plugging in, you're getting the actual hands-on skills and experience that will play out a role. And then you integrate with systems thinking, looking at how to solve any problem in the ecosystem, in the space where you operate. You're going to be the future of pharmacy. You're going to make a difference. And I believe we are all suited to make that difference in championing for the future of pharmacy together. Thank you. See you in the next video.